Welcome, everybody. I'm Laura Edidin, and I'm the Senior Vice President for Programs and Partnerships at Women Creating Change. For those of you who are joining us for the first time, WCC is an inclusive community that partners with organizations and New York City women and gender-expansive people who have been systemically excluded from civic processes to develop programs and influence policies that result in more equitable civic engagement. We advance gender equity through our advocacy, research, leadership development, and civics education, centering women of color, low-income women, and LGBTQ people. Our focus is on 5 issue areas: the environment, education, economic justice, safety, and what leads us to today's program, reproductive justice. I am so genuinely excited to share with you today the work of 2 incredible women at the forefront of ensuring that abortion is accessible, affordable, and stigma-free in New York. Sophie Nir and New York State Assemblymember Amy Paulin. As I mentioned earlier, you'll have a chance to ask both panelists questions in the final portion of our program. So as things come to mind, please put them in the Q&A. Anything else can go in the chat. Kicking us off today is Sophie Nir, the Chief Executive Officer of the Abortion Positivity Project. Sophie is the former executive director of Eleanor's Legacy, which recruits, trains, and supports pro-choice Democratic women to run for state and local office throughout New York. Sophie also founded Vaccine Vigilantes, I love the name, a collective of volunteers dedicated to helping people with language or computer literacy barriers make COVID-19 vaccine appointments. The Vaccine Vigilantes helped over 2,000 New Yorkers get vaccinated. Sophie is the former finance director for New York State Attorney General Letitia James, as well as a veteran of the campaigns of many prominent women elected officials. Sophie was named a 2022 City and State 40 Under 40 Rising Star and the 2022 New York State Young Democrats Leader of the Year. Sophie, over to you.
Thank you so much, Laura. What a tremendous introduction. I couldn't have done it better myself. I first want to say hello. My name is Sophie Nir, as Laura said. I am the CEO and a co-founder of the Abortion Positivity Project. I want to thank WCC so much for having us today, for facilitating this program. We think it's so important and we love partnering with organizations like you. So thank you so much, Laura, for having us today. So we are going to go through a slightly truncated but still comprehensive version of our usual training that we call Embracing Abortion Positivity. Essentially, our curriculum revolves all around destigmatizing abortion. And we say at the Abortion Positivity Project that that requires embracing abortion positivity. So let me share my screen and do give me a second for technical difficulties. How's that? Good. Great. All right, so let's jump right into it because we only have the time we have and we don't want to keep you late, and we will be joined by another incredible special guest pretty soon. So let's kick it off. So first of all, I will tell you a little bit about our org. We are the Abortion Positivity Project, and we work to destigmatize abortion by proudly promoting abortion positivity. So that leads to the obvious question, what is abortion positivity? And abortion positivity is a framework for understanding abortion without any stigma or judgment. Abortion positivity centers appreciation for the positive impact of abortion and recognizes abortion as a social good. We do want to start by saying that abortion positivity is in no way about judging an individual's emotions around their personal abortion experience. When we're talking about abortion positivity and destigmatizing abortion, we are always talking about the public sphere, the general zeitgeist, right? The common societal conversation that we are having around abortion. It is never, ever, ever about policing an individual's feelings or controlling any conversation that an individual is having with their doctor or trusted medical professional around abortion care. So let's start with the basics. I know this may seem simple, but you cannot imagine how many legislators are making laws around abortion and don't even know what the heck it is. So let's start from the top. What is abortion? Abortion is the intentional termination of a pregnancy, right? And there are 2 types of abortion: surgical abortion and medical abortion. There's a third type of abortion, that's self-managed abortion. We're not going to talk about that today. We're just going to talk about the types of abortion that are sort of legislated and publicly discussed. So surgical abortion happens, of course, in person in a clinic or a medical facility and can be performed at any stage of pregnancy. That's really important. A medical abortion can be prescribed in person or over the mail. And we're working on a third option that we're going to talk about soon when the assembly member joins us, and can be used up to 10 to 12 weeks of pregnancy. So the gold standard is mifepristone, and then 24 hours later, 4 pills of misoprostol, which you actually don't swallow, you dissolve them in your cheeks. So essentially, the process for a medical abortion is not, oh, I take a pill. It's, I take a pill and that stops the development of the pregnancy. And then 24 hours later, the misoprostol that you dissolve in your cheeks will create it essentially dispels the pregnancy. So that is when you have cramping and bleeding similar to a really heavy period. So when you are having a medical abortion, it is sort of a prolonged experience. It's not just you take one pill, which matters a lot when we're talking about the different kinds of legislation, when we're talking about travel for abortion, what does it actually entail? So medical abortion can be performed with only misoprostol, but it's less effective. We mention that because I'm sure that if you're paying attention, you are hearing that the Supreme Court is seeing a case or hearing a case soon that is essentially attempting to withdraw the FDA approval of mifepristone. So that would be a worst case scenario situation, but in that situation, medical abortion would still be able to be performed using misoprostol alone. So a really important thing to remember, every pregnancy has the opportunity to become life-threatening. Abortion is the treatment for many, many medical conditions, pregnancy complications, miscarriage, fetal defects, ectopic pregnancies, retained placenta. If you find out you're pregnant while you're going through cancer treatment, that pregnancy can heavily derail your cancer treatment, right? Then the pregnancy is threatening your life, right? And of course, we're going to go very briefly on how to access care. That's not what we're really going to talk about today. We're going to talk about stigma, but I do think while we have you captive, it's important to discuss. So there's all sorts of kinds of organizations that are working in the abortion space. We have abortion funds, which will help you pay for your abortion, practical service orgs, which help coordinate logistics to get you to your abortion appointment. That's become even more important in the wake of Dobbs when people are traversing spans of many states to access abortion care. You can read for yourself. There's examples of all of these organizations. We have legal protection orgs, information providers, which share knowledge on how to access abortion, pill providers that send abortion pills through the mail, and then we have clinical providers. A couple notes on abortion while we're at it. Never text or email with someone in a hostile state about abortion. We always recommend using a secure messaging app like Signal, so that if in a worst case scenario situation, police could not track your communications. We saw recently two women, a woman and her mother, who were sentenced to prison because they tracked their Facebook messages when they were talking about abortion. So do make sure your communications are private. And remember, if someone tells you they need abortion care, respond with confident, non-judgmental compassion, because everything's going to be okay. So let's talk about the history of American abortion, of course, abridged. I love to talk about abortion history. There's so much misconception around abortion history. So first of all, of course, abortion has always existed everywhere, but for America's first century, abortion was not banned in a single US state. Essentially, until the Civil War, reproductive health care was seen as a sort of like women's problem. And the medical field was controlled entirely and exclusively by men, and they had no interest in interacting. So the reproductive healthcare system, pregnancy and pregnancy-related care were really all done by these unlicensed midwives. And then in 1860, a coalition of male doctors changed their mind, and they decided that they wanted to get involved and make everything worse. Between 1860 and 1910, this coalition of male doctors went state by state and convinced every single state legislature in the country to ban abortion at the state level. Okay, so then what we start seeing after 1910, every state has an abortion ban active. In 1930, the statistics come out, right? They didn't have like the internet, so statistics take longer. They started to realize that women were en masse dying. And that they finally realized was a problem. So that all led to 1973 Roe v. Wade, which legalized abortion nationwide. I will note that Roe was decided 7-2 by a mostly Republican appointed justice court. And then immediately following Roe, the Southern Baptist Convention endorses Roe v. Wade. So in 1976, we saw the Hyde Amendment. The Hyde Amendment prevents federal dollars from being used for abortion services. And that was really the beginning of what we saw until we still see actually, of these sort of laws that create accessibility barriers. If you cannot ban abortion outright, you can just make it harder to access, right? You can put all sorts of nonsense waiting periods. You can put all sorts of barriers in place so that people cannot access care, even if it's technically legal. And then, as you all know, in 2022, the Dobbs decision removes the federal mandate to legalize abortion. So states can now choose to ban, restrict, legalize, or protect abortion at their own will. Something that I think is a really strong misconception is people think that there was a national abortion ban and then Roe removed it. That's not the case. There has never, ever, ever been a national abortion ban ever in the United States. And if you ever hear any politicians suggesting that there should be a national abortion ban, that would be the first implemented national abortion ban in American history. I think that's really interesting. There is no precedent there. It would be the first time ever. So we're going to just look at the map for a second. You can see this is a map we use from the Guttmacher Institute, and essentially it shows the state of abortion in the United States. Outright bans versus heavily restricted versus protected or well protected. Something that I always like to point out that really strikes me about this map is that the most restrictive states are clustered in the same states that allowed slavery when slavery was the law of the land before the Civil War. So I always think that there's a line to draw there. I will allow you to draw it for yourself. So we have two kinds of states now, right? We have access states and we have abortion hostile states. So in abortion access states, which are the states that we do our legislative work in, we've seen the overburdening of available abortion appointments. That makes sense, right? When we massively increased the number of people who needed to access abortion care while decreasing the number of abortion providers, we've well overloaded the system. And that creates a trickle-down overburdening of the reproductive health care system. If the doctor you see to get your birth control also does abortion care and their whole day is full of abortion appointments, that's going to have an effect on your birth control, right? We see clinic security concerns because the anti-abortion extremist minority has gotten extremely aggressive in their protesting against clinics, particularly in access states, because all of their they're now allowed to focus all of their efforts. So we've seen legislative and legal attacks on medical abortion. I talked about that. We've seen, of course, abortion providers, seekers, and facilitators are still at legal risk. There are all sorts of lawsuits in progress about states trying to come after providers in other states for mailing abortion pills, for traveling for abortion, all sorts of things. My lawyer told me I can't go to Texas. It's a whole story. We've also, of course, have the risk of a national abortion ban, and then widespread confusion around the availability of abortion care. Of course, we are very clued in, we know what's going on, and that is not universally the case, even remotely. There has been so much confusion. I've spoken to clinic owners who have had to call people and cancel their appointments, and they're like, I don't understand why, what's going on. The anti-abortion extremist minority is using confusion to create fear. And it's working. And then, of course, even more tragically, we have the landscape in abortion hostile states. We've seen the most horrifying cases, children who have been victims of rape and sexual assault, forced to give birth, horrible, horrible things. Women who have wanted pregnancies, whose lives are heavily at risk, and their governments are just playing absolute soccer with their lives as if they aren't even people. Absolutely tragic. So we have, of course, risks to patients' lives, severe emotional distress, legal and financial risks, misinformation, as we were talking about, rise in patients seeking extra legal abortion care. Extra legal care comes with additional risks, of course. And something that we talk about a lot at the Abortion Positivity Project, because it's something that we would like to work on legislative solves for, is there's a tremendous disruption in training for abortion providers, right? If you're in medical school and you want to be an OBGYN and you go to Vanderbilt, for instance, in Tennessee, you now legally cannot even learn how to perform an abortion. And if you look 10 years in the future, half of our medical students are in states where they can't even learn how to provide abortion care. So even the abortions that are quote unquote legal in the states that have, minuscule exceptions, they don't even have they don't and will continue to have even fewer providers who can provide that care. So let's do what we're actually here for, which is break down abortion stigma. So what is abortion stigma? Of course, abortion stigma is the latent implication that abortion is secretly bad, shameful, and immoral. And abortion stigma has been perpetuated for centuries by both supporters and opponents of abortion. And that's really why we exist as an organization, because we noticed that the abortion stigma that was so alive among supporters of abortion were really harming abortion access and abortion patients and abortion providers. So that's really why we exist. Among people who identify as pro-choice, abortion stigma manifests as euphemisms, qualifiers, avoiding the word abortion. You may notice that's something I don't do. Passing judgment at the circumstances in which someone decided to have an abortion, or using abortion negative language. So we do have to acknowledge that the language of the pro-choice movement has already failed. Right? So we need to try something new. We are now in the worst position for abortion access that we've been in 5 decades. So we need to try something else. Abortion stigma harms patients and providers by creating a hostile and unsafe environment for care, empowering abortion restrictions and bans that put lives and destinies at risk, and undermining medical and personal expertise. Okay, let's talk about something really important. If you want to convince someone of something, suggesting that it's secretly bad is a really, really ineffective way to get them on your side, right? So speaking about abortion positively maximizes the impact and effectiveness of abortion advocacy, right? So we always say, we always include this in every training that we do, right? Suggesting something secretly bad is the worst way to get someone to support it. If you feel these things, if you feel internalized abortion stigma, if you believe some of the things that we are about to tell you not to say, we can't tell you what to believe. But what we can do is tell you that saying those things, speaking those things and contributing those sentiments to the public discourse around abortion negatively impacts abortion access, right? So internalized stigma, as I was saying, the pro-choice movement has leaned heavily into abortion negative language, and we must shift the narrative. And we've all grown up internalizing this abortion negativity. So we really need to unpack it from within ourselves. So let's talk a little bit about language. First, we have our euphemisms, our avoiders, and our qualifiers. So anti-abortion extremists use the word abortion 4 times more than pro-choice advocates do. Did you know that? And that's because the abortion and the word abortion is so heavily stigmatized that even advocates for abortion don't feel comfortable saying it. But abortion is not a dirty word. We don't need to avoid saying it, and we don't need to distance ourselves from our own support of abortion, right? So common euphemisms that you'll hear or maybe say are choice, reproductive health or reproductive rights, women's health or women's rights, and then common qualifiers, abortion access or abortion rights. I want to be really clear. We are not saying that you cannot say these phrases. All I am saying is that you cannot say these phrases when what you mean is abortion, right? We can't say, if I'm talking about abortion and I say, I'm talking about reproductive rights, I'm not, I'm talking about abortion, right? If I'm talking about the whole slew of reproductive health care and I'm talking about sex education and I'm talking about maternal mortality and I'm talking about birth control, then I'm talking about reproductive rights and reproductive health, right? But when I'm talking about abortion, I'm talking about abortion. So when we embrace abortion positivity, we actively and intentionally do our part to destigmatize abortion. So we're going to go straight through with our strict abortion messaging. Really what we're going to talk about today is positive abortion messaging. But we will start with a couple of messaging don'ts before we start having fun. All right, so of course, we do not want to disparage abortion. That sounds obvious, but we hear all the time disparagements of abortion from abortion supporters. We don't use euphemisms to avoid the word using abortion. We are not ashamed or apologetic of our own support of abortion. We do not use stigmatizing language. We do not repeat our opposition's talking points. That is an extremely important thing to talk about, right? And then that gets to the next one. We do not allow anti-abortion narratives to control the conversation. Essentially, if someone says something like, abortion is murder, the worst thing you could say is abortion is not murder, because then we're having their conversation, right? Oh, I'm sorry if you can hear the sirens. Right, then we're having their conversations. If someone says to me abortion is murder, I would say abortion saves lives, right? Okay, so we do not evaluate the validity or reasoning of other people's abortions. Other people's abortions are none of our business. We do not use people suffering in banned states as political pawns. What does that mean? We have heard in the last few months, people saying things like, well, abortion bans are going to make my candidate win in November. It's not worth it, right? We are not, like, people who are losing their lives and having immense harm come to them because of abortion bans. They are not pawns so that we can get the president or the Senate majority that we want, right? They are human beings who deserve to have rights and their humanity intact. So we never, ever, ever talk about those people as if they're pawns. So messaging Jews, of course, we use the word abortion, love. We talk about our support of abortion proudly. We are knowledgeable. We lean into the topic, and we express how abortion aligns with our values, right? The anti-abortion extremist minority is really good at sort of defining the conversation around the idea that they have values and we have a lack of values. And that is, of course, absolutely, categorically, ridiculously false, right? We are people of tremendous values. I will say, for a personal example, I value freedom, and abortion allows people to exercise their freedom, right? I value safety of women, and abortion allows women to be safe, right? There are so many ways that abortion aligns with our values. So let's talk about goal setting, because this is something that gets really, really lost in the conversation, and I think it's one of the most important things we're going to talk about today. So first of all, what is our goal? Our goal is that anyone who decides to have an abortion should be able to access care without barriers or judgment. So really the whole point of today's training is to understand, how do we talk about abortion in a way that achieves and rather than undermines that goal. So that really goes back to what I was saying before around what we feel versus what we say, right? If there is an abortion negative or abortion stigmatized thought that goes into your head, that doesn't mean that you need to say it or add it to the discourse, because it is not in line with your goal, which is that anyone who decides to have abortion can access that care, right? So we always want to make sure that our advocacy, the things we are putting out into the world, are coming back around to the outcome that we want. And we'll talk about narrative control, right? Narrative control, language that stigmatizes abortion gives narrative control to anti-abortion extremists, as I was saying. And that's about setting the terms of the discourse. So we never, ever, ever want to play into the anti-abortion narratives, because we're doing their work for them. We should be making their lives hard and not easy. Something that I think is important to mention is that abortion is overwhelmingly popular. Nearly 90% of Americans support abortion access in at least some cases. Over 60% of Americans support abortion in most or all cases. Support for abortion has risen 15% since Dobbs, right? So your abortion positions are popular and you should be proud to support abortion. Sometimes when we talk about abortion, we do so from this sort of false low ground. We talk about abortion as if it's unpopular when it's overwhelmingly popular. And if the people you are talking about abortion to are vastly more likely than not already supportive of abortion. Right. And I always like to say, if abortion had 1 million supporters, I'm one. If abortion has 1 supporter, it's me. And if abortion has 0 supporters, I'm dead. Right. Because we would be proud to support abortion even if it wasn't popular. We are not suggesting that we should support it because it's popular, but we have a tendency to message on abortion from the low ground when we don't have the low ground. So let's talk about some terms that we hear a lot. So never, ever, 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 ever say pro-life. Even if it is to disagree or to disparage or to criticize the anti-abortion extremist minorities movement, we never, ever, ever use their word, which is pro-life. First of all, it's ridiculous. It's nonsense. They claim to be pro-life and they oppose every possible life-saving or life-protecting policy in the world. So we will never, ever, ever give them the high ground that they absolutely do not deserve. And we don't parrot their talking points, even if to criticize or disagree. And then, of course, a phrase you'll hear a lot, pro-choice. We can do so much better. Choice is a euphemism, right? Abortion is a positive thing. We don't need to distance ourselves. We don't need to say it, and we're proud to support it by name. As well, and also, there is choice does not exist without abortion access, right? So we're saying, oh, I'm pro-choice, abortion should be legal. Well, as we just discussed, abortion has been legal and not accessible for decades. So to suggest you're pro-choice is just not enough. So what do we say instead of quote unquote pro-life? We say anti-abortion, anti-reproductive freedom, or pro-forced birth. And then rather than pro-choice, I always say pro-abortion. And as I say, we are pro-abortion because abortion allows people to determine their own destinies and abortion saves lives, right? We support those things, so we are pro-abortion. The outcomes are positive, so abortion is positive. So does anyone want to type into the chat? I need to pull up the chat for myself, but what do you see as the positives of abortion? I've talked for half an hour about the things I think are positive about abortion, but I know you all have your own, so do feel free to add them to the chat. I know we're going a little over time and we have one more exercise to do, so add them to the chat, but I'm going to plow ahead. And we're going to talk about the 3 types of pro-choice statements, right? So within the framework of being pro-choice, you can be abortion negative, abortion neutral, or abortion positive. So do throw into the chat examples of any or all of them. We're going to go in order just for speed so that I can turn you over to the next very exciting guest. But some examples of abortion negative statements, safe, legal, and rare, right? We heard that a lot in the 90s and it really was pervasive. Suggesting that something should be rare obviously is suggesting that it's a negative thing, right? Abortion shouldn't be safe, legal, and rare. Abortion should be there should be as many as abortions as people who need them, right? Other women should be able to do what they want, but I would never choose to have an abortion. That can absolutely be true. It helps no one to say it. If I said, you can wear whatever you want, but I would never wear that, we fully understand that that's not a compliment, right? So it's not something that we should say about abortion either. Abortion is so sad or tragic. No, it isn't. No one would ever happily choose to have abortion. Yes, they would. So let's talk about some abortion neutral statements. People have abortions even if abortion is not legal. So true, bestie. Great. That's a neutral statement. Abortion should be safe and legal. That's neutral because that's the bare minimum. Abortion is medical care. So yes, absolutely. Again, that's the baseline. And I am pro-choice. And then we have our abortion positive statements. These are things that I've been saying for the last half an hour. I hope you've remembered some of them, but abortion is freedom. I am so proud to support abortion. Abortion must be safe, legal, affordable, and accessible, and I am pro-abortion. So here at the Abortion Positivity Project, we would like to remind you all to keep it abortion positive. And thank you so much for your time. Laura, should I turn it back to you to introduce the next guest?
Yes, Sophie, thank you so much. I don't think that I will ever talk about or hear someone talk about abortion in the same way ever again. And that is a compliment to you. And while you were talking, I was also thinking about the history of WCC. We're almost 110 years old. And one of the first achievements of the organization was founding a maternal health clinic. So this idea of women's agency is one that's really, something that we feel very deeply. So thank you for opening our eyes to talking about eliminating abortion stigma.
Thank you so much, Laura. Thank you for having me.
It's now my pleasure to introduce Assemblymember Amy Paulin, who has served the 88th New York State Assembly District in Westchester County since 2001. She chairs the Assembly Committee on Health and serves on the committees on Rules and Education. Her diverse legislative agenda includes healthcare, education, reproductive rights, child welfare, support for families, domestic violence prevention, sex trafficking elimination, government reform, sustainability, animal welfare, and gun control. You can see there's a lot of overlap here between the things that Assemblymember Paulin has focused her career on and the issues that we as WCC are focusing on. As one of the most prolific legislators in New York State, over 350 of her bills have been signed into law to date. Among her most important legislative accomplishments include writing and sponsoring the bill that eliminated the statute of limitations for rape, and sponsoring the landmark Trafficking Victims Protection and Justice Act, which dramatically toughened penalties for traffickers and buyers while providing support to the victims of human trafficking to help rebuild their lives. As a former human trafficking prosecutor, Assemblymember Paulin, I'm particularly grateful for your work in that area. In the last legislative session, Assemblymember Paulin authored the Birth Control Access Act, which greatly expanded access to birth control for New Yorkers by allowing pharmacists to both prescribe and dispense hormonal contraception. For those of you who joined us for our last webinar, you may recall that Rochelle Rodney of the New York Birth Control Access Project talked about her efforts to support the passage of that bill. This year, Assemblymember Paulin is aiming to achieve a similar expansion of reproductive health access, this time for abortion medication, which she'll speak about today. Assemblymember Paulin, thank you so much for being here. Would you please start us off by giving us a sense of the landscape of abortion access in New York State today, and then talk about the significance of your medication abortion bill, the one that I just mentioned?
Well, I think that I'm going to start with the bill. Abortion is legal and accessible in New York State, but you have to know where to find it. In my own family, when one of my nieces, who was, I think she was 18 or 19 at the time and needed an abortion, she didn't know where to go. So you think, oh, you go to Planned Parenthood, you go to your doctor, but if you're young, you don't know. And so there's because there is still a stigma of sorts around having an abortion, and some young people cannot even tell their parents. It's very important that accessibility and access and ease of access is paramount if you ever want to change that dynamic. So that's what my bill is intended to do. Currently, New York is set up like most other states. What most other states do is, if I am the physician or the nurse practitioner or a prescriber of some kind of medication of any sort, I write what we call a script, an individual script. I write it to you, Laura, because you need this certain kind of pill. or procedure. And so when you write a script, as an individual, it's very, how do you do that? If you want to more generally allow access, because the federal government is the one requiring or responsible for over-the-counter, any kind of, whether it's aspirin or whether it's, currently some forms of emergency contraception or some forms of birth control now are over-the-counter, but not all. So how do you allow access for the pills that we're talking about to allow abortions essentially available to people coming into a drugstore? And so we've set up a model, and I've done a number of these bills, and I just did it for birth control and pills, and it was signed by the governor very recently, that allows a prescriber, me again, the doctor, nurse practitioner, midwife, whatever, to write a script that says, and again, allowed by law, a general script, allowing anybody who I give that script to. So I'm giving that script to a pharmacist. I'm giving that script perhaps to a nurse who doesn't have prescribing ability in a clinic. I'm giving that script to an entity, and the law is allowing me to do that for anybody that comes in, a general script. And that's what this bill does. So what happens, therefore, is you, Laura, and anyone else who's listening could now walk into a drugstore, a pharmacy, that this script is present, and therefore you can get the drugs needed for a medication abortion. And that's because we can't in a state do much to make it over the counter, even though it should be, even though, frankly, other countries like India, I've never heard of an incident, I don't know if you have, where there's been a problem, but a woman in India, and you don't always think of India as being more progressive than the United States or New York, but in India, you can walk into any pharmacy and get medication abortion, and therefore it's completely accessible. And it takes, you said, we were talking, I heard the last speaker, wanting to turn it into a positive, or at least not a negative. It's a neutral thing. It's a health thing. It's something for a woman to be able to have if she wants it. In order to do that, it needs to be in a pharmacy. It cannot be going to a provider with potentially, it's almost asking permission, when you do that, to have an abortion. So that's why this bill is so critical toward that ultimate goal. And I'll stop there.
Thank you so much for walking us through that. One thing that came to mind when you were talking, Assemblymember Paulin, is what roles do advocates, including everyday New Yorkers, play in getting legislation passed? I'm thinking about your contraception bill from last year, and what lessons can we draw from that success to inform how to get this medication abortion bill passed?
The most important thing we were waiting for is because it's still not, there still was a hurdle for pharmacists to even dispense medication abortion. So now we have many providers in New York where they're eminently available. So it didn't make sense to pass the bill prior to women having real access because the drugs were there to be able to be dispensed. Now that hurdle's gone. So some of the larger pharmacies are applying and getting permission to do that. So now that we have that hurdle overcome, the next step is encouraging legislators that this isn't weird, that this isn't unhealthy, that this is something that we need their support on. And so I turn it back to everyone on this Zoom to contact their legislator and say, sign on as a sponsor. We need you. We need you to understand why this is important. We need you to help us pass it, because I don't have a lot of support yet in the legislature for this bill.
That's really helpful, I think, for our audience to know that there's a powerful role they can play by letting their legislatures know that this is something they're looking for their support on. Can you tell us where in the process this bill is, and help our listeners understand how a bill moves through the legislative process?
Sure. So the bill is in a committee. It's in the Higher Education Committee. You wouldn't think that, or you wouldn't understand why. And because we're amending the education law, all of changes of what we call scope of practice, this is somewhat in that vein, go through that committee. So it's the Higher Education Committee. Pat Fahey is the chair of the Higher Education Committee in the Assembly. She happens to be running for another office, so she won't be the chair next year. But she's the current chair, and members of that committee would have the say on whether or not that bill gets sent to what I assume would be the Codes Committee. So I would say anybody on the Higher Education Committee or the Codes Committee should be, and leadership for that matter, should be the target of an email campaign or a phone call campaign, or if it happens to be your legislator, perhaps even a visit to their office, both on the Senate and Assembly side of the higher ed committees.
Thank you for sharing that. And I think one thing that was powerful information for me at some point was when I learned that it's not enough to just call once, that legislators are looking on a daily basis, who's calling about what's important to my constituents. So, to our listeners, it's great if you can call once, but if you can call regularly, set a reminder on your phone, make it your habit, while you're having your coffee in the morning, you're making that phone call, you're keeping it on the radar of your legislator, which is so important.
So, but I just want you to know that I so appreciate you're doing this forum and involving more people in the debate and in the understanding of why we so desperately need to take the stigma off so that women get the healthcare they need, and to help with passing my bill, which I think is critically important. And I appreciate all the support.
Thank you so much for joining us and for leading the charge on this bill. Thank you. I'm going to turn back now to Sophie. And Sophie, we have some questions for you. And I will encourage people, if you have additional questions, just pop them in the chat. I understand that you were in Albany earlier this week for Lobby Day. Can you help our listeners understand what is Lobby Day and what role does it play in getting legislation passed?
Yes, absolutely. That's such a great question. So yes, the Abortion Positivity Project spent Monday and Tuesday of this week in Albany lobbying for the exact bill that the Assembly member was just discussing, the pharmacist dispense abortion medication bill. So essentially what we did is we went to Albany and we spent the entire day on Monday going from office to office and having meetings with either the legislator or the legislator's legislative director, which is a staff member in their office, about this bill. We had documents with our what's called a memo of support. So essentially, we have a letter explaining why we support the bill, why we think it's important, and the impact that we think it will have. We gave that to every legislator, and we explained from our own words, with our own personal experience, why we support this bill, and asked them, first of all, to sign on as a co-sponsor of the bill, right? Amy Paulin wrote the bill. She's the primary sponsor of the bill, but then the co-sponsors are all of the legislators who have sort of endorsed it. So we asked them all, one, to sign on as co-sponsors, and two, as they were all members of the Higher Education Committee, we asked them to help push the bill through committee, right? So also the legislative session is ending in June, early June. So we have about 3.5 weeks to get this done if we're going to be able to do it this year. So when you have a lobby day, you want to schedule it in a time that makes sense, but then it's like a little bit of a race against the clock, because we were asking all of these legislators to push it through committee. And then once we push it through committee, then we can get it onto the floor, and we need time to do all of these things. So that's what we were up to. That's what we were doing. We met with, I think, 11 legislators, and then we did additional lit drops, which is basically we just popped by legislators' offices and handed them our memo of support and some information about our organization and why we care, and asked them to hand it off to their legislator and make that bill a priority. Yeah, so that's what a lobby day is. And I will say, we went up Sunday, and on Saturday I was with my friends, and I was like, oh, I have to go to Albany, like, oh, it's so annoying. And then I was like, on Monday we were doing meetings back to back to back, and I looked at Sarah, my co-founder, and Jenny Kate, our wonderful lobbyist, and I was like, why am I having the time of my life? Like, why is this so fun? And it really is. It's like as you may be able to tell, I love talking about abortion. So getting to spend the entire day doing meetings where I just get to talk about abortion and educate about abortion and explain abortion to people who care about it and make them care more, like that was like a dream come true for me. And it was like one of the most fun days of work I've ever had in my life.
Thank you for sharing that, because it's something that I say all the time, which is for people who haven't yet engaged civically, the first time that you make that phone call or you get a chance to engage directly with your legislator, you give a piece of testimony, or you go and try and organize your friends to create change, it's such a rush. And you really captured it, that it's that sense of, I have an ability to impact the things that are most important to me. And once you do it, you never turn back. So thanks for sharing that with us. Another question I was thinking about is the fact that there are a lot of organizations in this space. I mean, the reproductive justice space writ large, and also people who are working to support abortion and abortion access. Can you help us understand what are the complementary roles that organizations play, whether they're small, whether they're large, whether this is one piece of their agenda or exclusively what they work on, and how does that fit in to advancing the work?
Yeah, absolutely. So yes, as you said, the space is crowded, but there is work for everyone to do. So when I know I went through a little bit in the training, but when we talk about abortion advocacy, there are so many pieces to that. And what we do is obviously destigmatization and abortion positive legislation. And then you have sort of organizations like ones you've heard of, Planned Parenthood, ACLU, these like big sort of brand name organizations, right? And they are setting a sort of vast legislative agenda. And then when you get down to like smaller organizations like ours, we're very nimble and we're very creative. So rather than have like a vast legislative agenda, we take on a bill or two bills that we think are interesting, exciting, creative, that we are passionate about for whatever random reason. And usually they're a bill that's a little bit more of a risk. It's a little bit more out there. And we have the flexibility and the freedom to put resources behind that. So there's so many things that need to be done, and we really all work together. And then, for instance, like there are organizations like WCC who have a membership, and we do trainings, and you have membership, and we can train your members. Like there's so many opportunities to work in partnership. And I think, yeah, there's always a piece of the pie for everyone. Particularly when you're looking into like the reproductive health space. Of course, yes, we only work in abortion. I don't consider us to be a reproductive health organization or reproductive justice organization. I consider us to be an abortion organization. And yeah, we fit into the pie just that way.
Thanks for that. I think sometimes people think about and talk about New York as being a blue state. And so the assumption is that abortion is readily accessible, it's affordable for people, there aren't any other barriers to abortion like stigma. How do you respond, to that frame?
Yeah. So I will say, one, it's never been true, and two, it's extremely not true now in the wake of Dobbs. So yes, New York is a blue-ish state. New York has a 24-week abortion ban on the books. We're hoping to, in November, get rid of that. That's a whole complicated thing. But yeah, we are not a state that would be considered in like the top tier of most abortion protective states, even remotely. And also do remember that New York is a huge state, right? New York goes all the way from like, the tip of Manhattan to Canada. So yes, maybe in Manhattan and in Brooklyn, abortion is relatively easy to access if you have money, if you can take time off, if you have a safe address where you can receive mail, etc. But when you go into other parts of the state where we have major access deserts. Also, what we saw with Dobbs, following Dobbs, was a 14,000 appointment increase in abortion. We have seen 14,000 additional abortion cases post-Dobbs than we saw in the same time period before. So the overwhelming of that infrastructure is happening very quickly. And more states are banning abortion, right? Florida just last week went from a 15-week ban to a 6-week ban. That is a world of difference. So anyone who is after 6 weeks, which is most people don't know they're pregnant by 6 weeks, who is trying to access care in Florida, particularly if you live in South Florida, think of the geography of it. If you live in South Florida, you have to drive like 20 hours just to get out of the state, and then you're in Georgia, which isn't any better, right? So we are going to see, I think, from South Florida specifically, a massive influx in people traveling to New York. Because if you think about South Florida, there's like 1 million flights from South Florida to New York every day. And then all of the people in the entire South that were going to Florida to access care between 6 and 15 weeks, which was a huge number of people, they all need somewhere else to go too, right? So the more states that continue to ban and restrict abortion, the more the access states like New York are going to need to pick up the slack.
Yeah, I have to say it's really sobering to hear you say that New York is not considered in the top tier of pro-abortion states.
Yeah.
I really want that to sink in, because I think it's an assumption that people make, and that there's a lot of work to be done even here in New York.
Mm-hmm.
So thanks so much, by the way, for those terrific questions. I'm going to turn to you now, Sophie, and ask you for your call to action. We heard Assemblymember Paulin say, please call your legislators and ask them to co-sponsor the bill. Call your legislators and let them know this is something that's important to you. What is your call to action to the people listening today?
Yes, so our call to action is, we have a sign-on letter that we are going to be filing in support of the exact bill that Amy Paulin was talking about, the pharmacist dispense abortion medication bill. I'm going to drop it in the chat right now, and you can add your name through the form, and I need to send you the letter also, which I will do right now through... I can do that, right? Yeah. Anyone with blame? Okay.
So check it out in the chat. Thank you so much for that. I'm going to add a call to action of my own, which is asking you to visit WCC's Civic Matters Hub. It's a free online one-stop shop for all things civic engagement. You want to know how to register to vote. You want to know who your elected officials are and how to contact them. You want to perhaps about this bill that we're talking about today. You want to know about events in your neighborhood touching on the issues that matter most to you. It's all on the hub, which you can find using the link in the chat. And by registering there, you'll also be notified of future webinars and other events that WCC is hosting. My thanks go to our panelists, Sophie Nir, Assemblymember Amy Paulin, and also WCC's Operation Manager, Anita Matthew, who has been behind the scenes today and in the run-up to this webinar, making sure that everything ran smoothly. We appreciate you, Anita. See you next time, everyone. Thanks so much.